A report out shows our area ranked high for COVID deaths, but the numbers don't exactly tell the whole story. KQ2's Danielle Soxie spoke to the health department officials about the report, who say it's not as simple as counting the cases.
For more than 2 years, people across Northwest Missouri have looked carefully at COVID-19 numbers to gauge how dangerous the pandemic has become.
Unfortunately, we are still losing people.
But a new report out by 24/7 Wall Street claims the virus has left a deadly impact on Northwest Missouri and Northeast Kansas. The report claims to be 359 deaths per 100,000 people, but the numbers don't tell the full story.
They do a formula to say it's so many per 100,000. Like if you had 100,000 people in your community, this would be the rate of deaths in that community. That way it's equal across the board.
So while the numbers rank high per capita, health officials say this is what's really happening.
Since January of 21, we've only had 4 months where we had more than 10 deaths in a month. Most of the months were single-digit numbers.
Bradley stating the largest number of deaths occurred in December of 2020, resulting in 51 deaths. This occurred when the Delta variant hit right before vaccines were released.
In January of 22, we had over 5,000 cases, but only 5 deaths. So December of 20, when we had the 51 deaths, we only had 2,200 cases. And a lot of that was attributed to people having the vaccine and the boosters, as well as the Omicron variant not making people as sick as the Delta variant did.
Now, the St. Joseph Health Department is back to averaging almost 30 positive cases per day and deaths in the single digits each month.
We're still stressing the importance of the vaccine and getting boosters. And if you're sick, stay home. Some people, if you feel inclined, wear a mask, keep your distance, things like that. Because people have to take their own steps to protect themselves.
Reporting, Danielle Soxie, KQ2 News.
The St. Joseph Health Department has reported up to 261 deaths related to COVID-19 thus far.